Good morning everyone and welcome back to another day in the life video. It's about 6:20 in the morning right now and I'm just getting ready to head off to work from 7 a.m. until noon. I've been working pretty much through the entire weekend, and these past 2 weeks I've been working about 19 hours over the weekend on top of the pretty much 40 hours per week that I'm working at the clinic. So it's been really busy, but there has been some fun intermittent things, such as I got to actually meet up with my buddy. Shout out to Caitlin for going on a tour with me and just kind of getting to see campus as she prepares to start her DPT school journey. I believe on Wednesday this week is when they start orientation. So good luck to Caitlin and everyone else who is starting their journey coming up this following week. But I'm excited for this week. As I mentioned in the last video, we're going to have the opportunity to go into the emergency department for my clinical experience, just get to kind of see exactly what happens, what physical therapists do within there. So I am really excited for that. And on top of that, for my regular orthopedic floor experience, I believe my clinical instructor is going to have me kind of run through rounds and actually be the one responsible for responding to my interdisciplinary team for the physician assistants, the nursing staff, occupational therapists, everything like that within there. So it will definitely be a very packed week, but it should be really fun overall. So I'm just going to get ready for work and I'll talk to you guys later. Today was another really solid day overall. I actually had quite a bit of variety in the presentations in my patients today, even though a majority of them were patients who had spine pathology. But overall, it was just a really good experience because I got to do a co-treatment with an OT, working through kind of how you approach differently a scenario with an adult who has developmental delay, and kind of working through the commands that you have to go through, and just seeing how much of an impact having the caregiver who knows the person really well being there can really change how they act and how they perform. So that was a really unique experience, as well as on top of having lots of the, for the most part, regular spinal procedures. I had my first patient who had undergone a below knee amputation. So it was just interesting getting to work through that, kind of adjusting exercises, thinking about considerations that I don't have to normally do, like protection of the limb and just kind of a lot of the nuances that you don't see in other cases. So today was really useful. At the end of the day, I also got to see one of the patients that I worked with all through last week have a humongous smile on their face as they were getting ready to leave and go back home. They were extremely appreciative when I came to say goodbye, and it was just really awesome to see that impact that I had on their life. But I am really tired now. I think I'm going to spend the rest of tonight completing my clinical performance instrument. I got about halfway done the other day, so I'm going to try and finish that, as well as review a little bit of my manual musculoskeletal skills, because I met with the person that I'm going to be with in the emergency department starting tomorrow, which I'm very excited about. A little bit nervous just because it's different from what I'm doing right now. So I don't know exactly how to prepare for it necessarily. They said that I don't need to do anything special, but I just want to make sure that I give myself the best chance possible to get some of that hands-on experience with people in the emergency department. So I'm going to review that, but I also think I'm going to take some time to nap really quick because I need a little bit of rest before my brain keeps working more. So I'm going to get off to that, and I'll talk to you guys later. First impressions coming back from the emergency department are, wow, time absolutely flew by. It was a really interesting experience overall just because of the variety of patients you got to see. It was essentially everything was an evaluation, treatment, and send off on their way with either recommendations or any of the assistive devices and other items they may need. So it was just extremely fast paced. We got to see many, many patients overall, and it was just a really fun experience. So I'm really excited. I'm going to be going back again on Friday at 9 a.m. Similar thing, I went from 9 a.m. until 5:30 p.m., which I believe is about an 8-hour day, but it was crazy busy, lots of things to do. I found there are two different kind of systems that they have within the hospital that I'm at, where they have the super track, which is where you kind of have your more, okay, we're going to get people through really quickly. They just need to be seen and double check. And then we have more of the urgent care, where you have more time to just kind of think through things, assess, just kind of delegate of where things need to go. So it was a great experience overall. I'm very happy I had this opportunity, and I'm excited for the end of the week to finish off on it as well. But that's pretty much all that's happening today. I think just because of my experience there and all the things that emergency medicine kind of does, I'm going to spend a little bit of time tonight reviewing some past material just on things such as imaging, as well as double checking that I know all of the red flags that I should be looking for and a couple of the kind of manual techniques, just so that I can feel a bit more prepared. Not that I wasn't today, because overall I think I fielded questions pretty well and just gleaned a lot from the experience. So I'm going to get to that, finish up the end of my CPI tonight, and then make sure to get some good rest because I am definitely going to be tired tonight. So I'll talk to you guys later. Well, that was the last regular day of the week, all done. It went really well. I ended off the day talking about the clinical performance instrument assessment with my clinical instructor. Overall, it was really positive. She said that I am kind of above where I need to be right now, so I'm feeling very good about that and just trying to push forward and continue on where I'm at. It sounds like we have a good plan and an outline of how the rest of the experience will go, some of the things I'll start doing, as well as some of the possibilities of different places throughout the hospital that I can go and see so that I can be exposed to more of those things. But more on that once I know that they're all confirmed and everything. But the rest of tonight is pretty much I'm going to do a short call with some of my friends to kind of catch up, tell them a little bit about the emergency department and how that went, and then maybe just review a bit of material before I go into the emergency department tomorrow for my last day of clinic for the week. So I'm going to get to that, and I'll talk to you guys later. My last day in the emergency department went really well overall. I had lots of opportunities to really connect with my patients today. I think we saw only 3 or 4 patients, and we were kind of in the main urgent care kind of side of the emergency department. And there was one patient that we took, I think, about 2 hours on, just because of the nature of their pathology, going through a low back pain case, very acute with lots of pain. So just taking things slowly. I got the chance to see some dry needling in action, kind of talk through the mechanisms that at least are out there right now. It's one of those things that isn't fully supported by lots of literature right now, but just seeing the impact that it was able to have on this patient really quickly was an awesome sight to see in person. And then another one of our patients we spent a good while with, and I got to really kind of listen to their full story, hear lots of their background, their upbringing, and just had that chance to connect with them. So that was a very unique experience overall. But that's pretty much all that I have for today, as well as this week. I'm just heading over to work now, where I'm going to work from 5 until 9 p.m. and probably go straight to bed as soon as I get home, because today was a long day, but it was really great overall. This week has been awesome, getting the chance to go into the emergency department. I think overall it's a place that I could envision myself actually being in when I graduate, just because it's very unique. There's lots of autonomy within it and lots of interdisciplinary kind of interactions. So I thought that it was really cool. I hope that I will be able to have an opportunity to go back there again someday. But that's all that I have for this week. If you want to keep following me along as I go through this clinical experience, we're going on to week number 6 next week, where I should be pushed further and further out of my comfort zone and trying to utilize possibly some PT aids or some of the nursing staff to help me throughout some of my sessions, just to kind of get that feeling of how to delegate things throughout a session when you're working with someone outside of your field. So I'm extremely excited for that. If you want to see it, make sure you look out for that video next week. If you enjoyed this one, make sure to like and subscribe down below. Thank you so much for watching. This has been KB DPT, and I'll see you all in the next video.